Hi, my beautiful people. How are you doing? I know you people are waiting for this video. So let me just start, to tell you people like the difference between Germany and Switzerland based on nursing, nursing profession. So number one thing, I will just make the 5 points, okay? Nursing in Germany versus nursing in Switzerland. Yes, I know many people are waiting for this, and many people have asked me, okay? So let me just give you five. So maybe and in the next one, we're going to do another one, okay? So that we'll be doing it like that, small, small. So where are we going to start today? Like in Germany, yes, in Germany, in Germany, they don't have nurses at all, okay? And will I call it the worst or the saddest part of it is that, like, you see the people that did nursing assistant, the people that did 1 year nursing hospital, like, they don't allow them to do anything. Like then, or I don't know of as of today, they don't allow them to do anything. It was a time that they sacked all the 1 year, nursing assistant people and asked them maybe to go and be sharing food or to go and make like ask the patient what they want to eat, like make food order instead of them to help nurses, you know, so that two of them will be working at the station. You tell them after 1 year. Do you know that 1 year hospital is not easy? Like you will read like what I read when I did my 1 year hospital. I didn't even read like that when I did my main hospital. Let me just tell you, because nursing 1 year hospital is not easy because this is your starting stage. And after doing that, they are being asked to share the food or go and make an abfrage, and you make order, like ask patient what they want to eat. The patient will tell you what they want to eat, then you record it. But here in Switzerland, like nursing helper, nurse assistant, some people are doing it like weeks. Some people are doing it like months, like 3 months, 6 months, some weeks, you are done. And you are so respected here. Okay? And you will be doing work, not even that you are washing patients. You'll be doing work, you'll be taking the vital signs of the patient because this is what they teach you. And you'll be working according to what they teach you in school or what they taught you in the school. So with this, it makes the nursing work here to be a bit, less strenuous to compare to Germany. And this is one thing Germany should know. All the countries, even myself, I'm from Nigeria, and in Nigeria they have like nurse assistants that support the main nurses while working. So why is it different in Germany that after somebody finish 1 year hospital, you don't recognize that person as nurse assistant? You don't recognize that person as somebody that can help or support somebody in doing work. I don't get that. It's not good. So another thing in Germany, the Aufgabe of a nurse, the work of a nurse. In Germany, you just, freshen your patient up, give your patient medications, like so on and so forth. You want to do another thing, or if you see your patient, maybe your patient is having a hypotony or hypertony, then you have to call your call your doctor, to inform the doctor that your patient is having so and so sign. Okay. But here in Switzerland, as a nurse, you know your duty. So, like, they have like a reserve. This reserve is like better of what your patient is going to have. When the patient is, having any signs of disorder or any other thing, maybe the patient is vomiting or something like that, you have the medication that you will give written down there. Okay, even if in Germany, when they write it down, you still call the doctor and ask. But here in Switzerland, it's your duty to know, okay, let me give my patient this. You don't need to consult the doctor, okay? So in some cases, yes, maybe you might consult after giving the BEDAV or the reserve, then you can now call your doctor and tell your doctor, okay, look at, I have given this and the patient is still, hypotonic and something like that, okay? So that is just it. This is number 2, okay? So the number 3 of it is rest time. You see, in Germany, you work like, okay, they don't work many hours. Germany work like 7.5 hours. Some people work 8 hours, okay, with your break. But in Switzerland, they work like 8.5 hours, some 9 hours. Okay, so after working, let's assume that you did your night duty today and you come out in the like you did your night duty yesterday and today you just come out from your night duty. Okay, you cannot go to spätdienst, or nobody can call you and tell you to come to work, because if you do that, when you are at work they will send you home because you need to rest. The time you work again is the next day, or else you want to do like night duty. Okay, then you can now first night duty, second night duty. But you cannot do night duty and the next day you do spätdienst, or you cannot do spätdienst and the next day you do morning. It's not possible. They are not doing it here. Or else you left your working place very early, that when you check the hours, you know that is equivalent to what you're supposed to rest before coming to work. Okay, so you cannot do it, because in Germany I knew when I worked my first place, I worked like after spätdienst I will be at home, like because I was going with train, I will be at home around 11. After 11, before I sleep is 12 o'clock, and 4 o'clock you wake up again and start going to morning duty. Nobody, you can't do it here. It's not possible. They will send you home. Okay, so that is number third. Then the fourth one is your nurses to patient ratio. Like here in Switzerland, nurses to patient ratio, like in Germany, when I work in the stroke unit, you might find out that maybe you are alone taking care of 6 patients, 8 patients, 7 patients. But here in Switzerland, no, you cannot do that. The highest amount of patients you can take care of in the stroke unit is 4 patients, like 3 stroke patients and 1 post patient. Okay, and you also have fagés, you also have assistant there. You're not doing it alone, and another person will take another 3 or 4. Okay, so the fifth one is the salary. In Germany, as a nurse, you share the food, you wash your patient, you give your patient food, you make off from, and you clean the body, you do this, you do that for that money. But here in Switzerland, you know your work, you do your work. Okay, everybody do their work for that big money. So Switzerland is known, is known for paying nurses large amount of money. So that is just it. That is just the difference. Okay, and how do you see it? Where are you? Where are you where are you dreaming to be? Where are you planning to stay and do your nursing work? Is it in Germany or in Switzerland? Just drop it in the comment section. If you still have any question, drop it in the comment section. We are going to see us all in the next one. Okay. Okay, bye.